We have all been there. You are in the middle of something important, maybe a long meeting, a busy work task, or even just relaxing, and you feel that familiar urge. Your body is telling you it is time to use the restroom, but you decide to wait a little longer. What actually happens inside your body when you consistently hold in your pee? Delaying urination can lead to a range of issues, from immediate discomfort and pain to more significant health challenges over time. These can include frequent urinary tract infections, or UTIs, potential bladder dysfunction, and even the risk of kidney problems if the habit persists and becomes severe. Your bladder is an amazing, expandable, muscular organ designed to store urine temporarily. When it fills to a certain point, stretch receptors send signals to your brain, indicating it is time to empty. Regularly ignoring these signals forces your bladder muscle to overstretch. This prolonged overstretching can weaken the detrusor muscle, which is responsible for contracting and emptying your bladder. A weakened muscle may not be able to empty completely, leaving residual urine behind. This stagnant urine becomes a breeding ground for bacteria that naturally enter the urethra, vastly increasing your risk of developing uncomfortable and potentially serious urinary tract infections. Furthermore, the increased pressure from an overly full bladder can, in rare but severe cases, cause urine to reflux or back up into the kidneys. This condition is called vesicoureteral reflux and can lead to kidney infections and long-term kidney damage. Chronic holding can also contribute to conditions like overactive bladder symptoms or even lead to bladder pain syndrome. The good news is that preventing these problems is quite straightforward. The most crucial step is simply to listen to your body and respond to its natural cues. Aim to empty your bladder every 2 to 4 hours during your waking hours, even if you do not feel an intense urge. When you do go, take your time and relax, allowing your bladder to empty fully. Avoid hovering over the toilet or rushing, as this can prevent complete emptying. Staying well hydrated with water is also key, as it helps flush your urinary system and dilute bacteria, reducing their ability to cause infection. Understanding your bladder's rhythm and respecting its limits is a powerful tool for preventative health. For example, some people learn to bladder train to gradually increase their bladder capacity, but this is a controlled process under guidance, not prolonged holding. Consistently ignoring your body's signals can make your bladder less responsive over time, a condition sometimes informally referred to as lazy bladder syndrome, where the bladder doesn't signal effectively. Being proactive about healthy urination habits helps your bladder maintain its elasticity and strength. By paying attention to your body and adopting simple, regular restroom habits, you can effectively safeguard yourself against discomfort, reduce your risk of infections, and prevent more serious bladder and kidney complications. This mindful approach ensures your urinary system functions optimally, contributing significantly to your overall health and well-being.